Okay. Uh, yeah. So we're about to go into the rhythms. Now, remember step number 4. What was step number 4? So step number 4 is where we look at, for instance, axis. We're going to talk about, we've already covered that part. Step number 5, we're going to look for evidence of hypertrophy. That's coming up, and that's coming up later. And then step number 6 is where we're looking for infarction. All right, so how are we on? We've got a few minutes, so we got a few minutes to our break, so let's just keep going for a moment. Let me clear some of this off the screen, just so I free up some space. So I hope you're learning every day, guys. We are learning. We're just building the story a piece at a time. And then we're going to put it all together as we start interpreting the rhythms. Okay. Now, I'm on page 51 of your workbook. This picture here, you're going to see this picture over and over and over again. You've noticed that I use a lot of pictures. Okay. The reason I use pictures is the brain thinks in pictures. Okay. When you think of if I say think about Chris, you think of somebody you know named Chris. If I say, think about your car, you picture your car. You don't picture the word C-A-R. You picture the vehicle. So if I say picture your door, your front door, you picture the actual door. You don't picture the letters F-R-O-N-T space D-O-O-R, right? So we think in terms of pictures. We dream in terms of pictures. You're never dreaming with like words going across the screen of your mind, right? No, you dream in pictures. So pictures is a great way for us to be able to communicate the information. It's a great way for me to show you because it gives you something to visualize. Even people who feel they are maybe an auditory or a kinesthetic learner, their brain actually recalls information in pictures. They may have another learning style that they prefer to receive information, but the brain actually recalls in pictures. Okay. The reason I want you to know these pictures so well, though, is it's going to help you understand, but you're going to be able to use these same pictures and draw these pictures for your patients. You know, I've told you the story of how when I was a paramedic on the helicopter, medical school, beyond whatever, I always carried, for instance, a Sharpie in my uniform, in my scrub shirt, lab coat, whatever. I always had a Sharpie with me, and I would write on anything, whether it was a paper towel, a bed sheet. I'd write on somebody's arm. I'd write on the window in the hospital room. It didn't matter because I always used a Sharpie just because that worked on most things. But it was a great way to be able to explain things. You need to take the time as a clinician to explain things to your patient. So really educate your patient and don't just tell them information and don't just say, all right, you understand, because they shake their head 17 times like they understand. No, they don't understand. What I do is tell patients, hey, I'm going to show you this, but I'm going to have you repeat it back to me. So go ahead and prep them for that so that you know they're paying attention. A picture would be a great way to do it. So I want you to memorize this picture. So all I've done here, it doesn't have to be perfect. Watch how I do it. I'm just going to do that. Okay, you got it? And I'm just going to crisscross that. Of course, that's just my little simple version of the chambers of the heart. Obviously, we have, for instance, the right atrium, we have the right ventricle, we've got the left atrium, the left ventricle. You can use this little simple diagram. Now you can put in your valves. For instance, we've got a tricuspid valve here coming from the right ventricle. We've got, what's that one called? What is this one here? Of course, that's going to be the pulmonic valve. Of course, that leads to the pulmonary trunk, goes through the pulmonary arteries. The left and right pulmonary artery goes to the lungs. All the blood from the lungs, of course, comes back into you should know this, comes into the left atrium through how many pulmonary veins? That's right. It's going to be 4. Blood comes through into the left atrium, goes through what's this valve? That's the mitral or bicuspid valve. So we have tricuspid on the right. We have bicuspid on the left. When blood leaves the left ventricle, this is all review. You should know this. It goes through the what? It goes through the aortic valve. Then it goes into the aorta. Remember, it goes in the aortic arch. What do we know about the aortic arch, for instance? Okay. So we have, for instance, we have baroreceptors there that help maintain blood pressure or regulate blood pressure. Okay. I've already talked about, for instance, baroreceptors in the context of the nerves that are involved. So whether we're talking the glossopharyngeal nerve, so cranial nerve 9, whether we're talking the vagus nerve, so cranial nerve 10, that's involved with the baroreceptors. The signal activates those nerves and goes through the different pathways in the brain stem, for instance. But let's say we're in the aortic arch. What else do we know? So we had those 3 divisions off the aortic arch. What was the first one? This first one here was we have the brachiocephalic trunk. This is all review, guys. We had so from the aortic arch, we had the brachiocephalic trunk. Our next division was the left common carotid artery. The next one was the left subclavian artery. Remember all of this? Okay. But from this same little picture here, so not only can I cover the heart itself, we can talk about all the chambers, we can talk about all the valves, we can talk about valve pathology. We can, for instance, if I'm looking at just this left ventricle, we can talk about things like preload. And then as blood leaves the left ventricle, we can talk about things like afterload. You see how much ground I can cover from a simple picture, right? But it's also easy to be able to figure out what's going to happen when I have a picture in my head. So I can recall a lot of information very quickly with these pictures, okay? The other thing you're going to see here is, for instance, here's our representation of the heart, but I also tie in the conduction pathway. So we've got, remember that, what's this one called? That's the SA node. What's this guy right here? Come on, talk to me. That's right. It's the Bachmann's bundle. That's how the signal goes from the right side of the heart in the right atrium to the left side of the heart in the left atrium through those gap junctions, remember? Now, before the signal goes from the SA node to the AV node, it has to go through, what are these guys called? Those are those internodal pathways. Remember, this was day 1. We're on day 5 of the EKG Mastery Challenge, but look how much we've covered in our time together. We said that the signal goes from the AV node. It takes that little pause so that blood can now go, the atria can contract, because first the atria have to depolarize. That's the P wave. Remember, that's the period of calcium going into it. But then the atria have to contract. That's also where calcium is there. But then while the atria are contracting, the ventricles are at rest. So during that part, of course, that's going to be that PR segment. Then the signal goes from here through the bundle of His. It goes to the right bundle branch. It goes to the left bundle branch. We said that the left bundle branch, how many divisions does it have? The left bundle branch actually has 2 divisions. There's an anterior division, and then there's a posterior division. What's the blood supply of the left anterior fascicle of the left bundle branch block? Or let's just say it as anterior fascicle of the left bundle. That's how I should have said that. What's the blood supply of the anterior fascicle of the left bundle branch? Okay. That's going to be the left coronary artery. But what's the blood supply of the posterior fascicle of the left bundle branch? That's going to be the right coronary artery. So remember, we have the right coronary artery that supplies this piece, and then the left coronary artery or more specifically, the left anterior descending, supplies this fascicle. So just make sure you know all of this. But from this picture, we can now cover the heart, the chambers, the conduction, the SA node, AV node, bundle of His. We talked about left bundle branches, right bundle branches. Purkinje fibers are, of course, down here. We can cover a whole lot of ground with a picture, right? All right. Now, what I want you to do is I want you to make sure that you draw the same kind of little picture here and make sure that you go ahead and label everything. Okay. I want you to just be able to very quickly do the same kind of situation. All right. Because, and practice this, because this is exactly what you want to be doing with your patient. All right. Now, let's see. Where are we? You know what we're going to do? We're going to go ahead and stop now for our break. And then when we come back, we're going to go like one after the next. And I'm going to explain what happens in a whole bunch of rhythms. So I've got, I don't even know. It's several rhythms that we're going to cover. And we're going to use that same picture and we're going to kind of systematically go down. So take this same picture here. We're going to start up here with the SA node. And we're going to talk about the rhythms that come from the SA node. What? And then we're going to talk about rhythms that start at other parts, for instance, in the right atrium. Things that happen with pacemakers in the left atrium. Then we're going to get to, so we're going to cover all these different atrial rhythms. Then we're going to get to the junction. We'll talk about junctional rhythms. Then we're going to go down in the ventricles and we're going to talk about ventricular rhythms. So we're just going to use this picture and methodically walk our way through the heart and talk about multiple rhythms. So everybody, we're going to take our 10-minute break and I will see you right back in 10 minutes.